Well, just over 1 year ago, Community Health Network administered its first COVID-19 vaccine, and so far the network has vaccinated 500,000 Hoosiers. Dr. Robin Ledyard, Chief Medical Officer for Community Health Network, is here with us this morning. It is hard to believe 1 year later, isn't it?
Yeah.
And here we are, kind of in the thick of things yet again.
Right. Yeah, and out of the gate, we were so hopeful. So many people came forward. We did, I think there's so many issues with what happened out of the gate. We had a limited supply, and so we stratified the eldest population because we knew with COVID out of the gate that the elderly would get sicker.
Right.
So we wanted to take care of them first, which was the right thing to do.
Yeah.
But we just couldn't move fast enough. And then I think with some of that hesitancy, people have always had vaccine hesitancy. And so I think with that increased hesitancy related to a new disease, a new vaccine that came forward so fast, we just have gotten a little bit behind, and it's allowed COVID to mutate and cause these new variants.
And speaking of new variants, we've got Omicron. I want to make sure that I pronounce that correctly, because I mean, we're seeing video of kids getting vaccinated here as well. This is something that that has been fairly new, but this new variant also fairly new. And you and I were chatting earlier. This is confusing. I mean, let's just put it out there. This is confusing at times.
It is
because
confusing.
You wonder, do I have it? My neighbor had it. They were fine. My other neighbor had it. They were terribly sick.
Right. Several things for all of us, right? We have never lived through a pandemic. We've never had a disease that spread worldwide like this.
Yeah.
And who would have guessed that it would mutate so fast, right? And so viruses have to have a vector. They have to be able to spread human to human. And if they can, they're going to adjust their spread to spread faster. And that's exactly what's happened with Omicron.
That is so interesting.
Yes.
It really is. And I know the information shows us that Indiana actually ranks the lowest in terms of people getting vaccinated. I know a lot of people still reluctant to do so, but what is the best way to convince them, okay, this is something we need? I mean, that's $1 million question.
It is.
And I know people, understandably so, just have concerns. I think everyone just wants to be safe. They want to be protected.
Right.
On both sides of the spectrum, I guess.
Right. Like I said, I think there's always been vaccine hesitancy. And so people are less inclined to get a treatment for something they don't already have. They'll wait until they have it.
Right.
And so there's always been that, and then I just think the newness of it. But what I would say is, today I checked this morning, there have been about 4.5 billion with a B, doses of the vaccine given worldwide. And so again, there's no other treatment or prevention that has been spread so quickly. And we have not seen complications that get bad press. We have not. In those 4.5 billion, what has happened is we've saved lives.
Yeah.
And so I still, with Omicron still today, the best course of action is, if you haven't got a booster, if you're fully vaccinated, get the booster to build up your antibodies.
And is the booster, you have to wait so many months,
6 months.
6 months.
6 months.
6 months to get that.
And if you had Johnson & Johnson from the beginning, there's good evidence to go ahead and get a Pfizer, Moderna to do the mix and match.
Right.
The CDC's recommending that.
Okay.
And then wear your mask, again, especially when you're in public places and you're going to be closer than we are if you're not aware, and be aware of your surroundings.
Right.
And again, if you feel sick at all, chances are really high right now that you could have COVID.
Yeah.
So get tested, take care of yourself.
That's the tough part, because you don't know. You're wondering, is it the flu? Is it this? Is it that? And speaking of, from my experience, just talking with colleagues and friends of mine, I mean, getting testing right now, it's very short supply.
It is. And so you may have to look at various places, look at the state website, see what's available there, check the Walgreens, CVS, all the health systems. I still think that you can find a slot, but I will tell you, like the last couple of days, especially after the Christmas weekend, testing sites are a little bit delayed.
I've noticed that.
Yeah.
Anything else that we need to know, that viewers perhaps need to know before we let you go?
Yeah, I just think, again, if you feel sick at all, chances are really like a 50-50 that you could have COVID.
Yeah.
And so even if you've been vaccinated, get tested so you don't spread.
And very quickly, does it take time for that, if you do have a negative test the first time? Because I know people who've had negative tests, then they wait however many
with
days.
Omicron, what we're seeing though is a faster replication of the virus.
Okay.
So you often become positive within 3 days of exposure. Where it
Wow.
was 5 to 7 with Delta, it's now 3 days with Omicron. So go ahead and get that test so that you can isolate, let yourself get healthy for about 5 days, which is what the CDC is recommending now.
Right.
That's a new change too. Let yourself heal, get some rest, and then hopefully we'll continue to get through this. I know Hoosiers want to take care of each other.
Certainly so many unknowns, but thank you so much for your knowledge and expertise. Of course, there's that QR code on the bottom left-hand corner of your screen where you guys can find out more. Doctor, thank you so much. We appreciate your time.